Don't forget to click the subscribe button
and the notification bell
to see more of the Contessa's videos.
Good day, everyone. Welcome to the CSA Medical Aesthetics. Dr. Contessa here, your certified aesthetic physician. In today's episode, we have another topic, the so-called lower cog lifting or the marionette line lifting, as well as the upper neck thread lifting. In today's episode, we have our guest again for the second time, and she's coming back. Let's all welcome Ms. Vira.
Hi, good day to you.
Welcome back, Ma'am Vira.
Very happy to be back.
Yes. So actually, in our face rejuvenation, it's really very important that we balance everything. They say beauty is balanced, beauty is harmonious, right? And it should be like proportionate. Because in the past, we've been discussing about upper third, middle third, like rejuvenation via thread lifting. Of course, we also have to work on the lower part of the face. Di ba, Ma'am Vira?
Yes.
Yes. Because some people are coming in here for concerns of like their jowls, this part here, or concerns of marionette lines. And even the others, they have this turkey neck, okay? And the others have this lost jawline definition, or like they notice that they already have this some sagginess here. The others nga, Ma'am Vira, they were saying parang bulldog appearance here daw, or like, or here. Everything is down, everything is like heavy here on this part here. That's why they were saying daw with the aging, dati inverted triangle, no? Or the V. But as we age, it becomes the pyramid of age. Everything goes down. And with the pull of gravity, aside from, of course, as time passes by, collagen breaks down, or your hyaluronics, elastin, they get depleted. So all those aging processes, no? So this part here, we also have to work on it, right? What do you think of that, Vira?
Perfect.
Yeah, right? Kasi, especially here, they call the puppet lines here. So I have patients coming, Doc, you have to treat this, the puppet line here. So for some people, it bothers them. Right? Well, kasi Ma'am Vira, actually, looking at her, minimal pa lang. I could say mild. Oh, diba? I think Vira is really doing maintenance care, anti-aging treatments, right? And hindi pa ganun ka-prominent eh. Are you sure you're 63?
I'm 63.
Are you sure?
I'll show my passport.
She looks really so young. So, of course, by this time, we can do treatments to prevent or delay the process of aging.
I like that.
Okay, so what kind of procedure for the lower third of the face? We'll show that when CSA Medical Aesthetics returns. Back, mga ka-CSA. So we're doing the lower third of the face. Okay, so what is the demarcation from the outer groove towards the tragus of our ear? Okay, make a horizontal line, and inferior will be our mandibular line. So this is our border of our third, or the lower third of our face. Okay, so anatomically speaking, what we're trying to also like do a marking for is the mentalis foramen. So we have upper third, supraorbital, infraorbital, and then the mentalis foramen here. If you make an X mark there, so we also have neurovascular structures there. And also for the lower third, we have to also palpate for the mandibular notch here. And we know that in that notch, we have a facial artery that goes upward like that. And it will branch out to your labial arteries, inferior and your superior. And this one will go up to end in angular artery. So those are the vascular structures, and then of course your facial nerve. Okay, so we know that facial nerves they have 5 branches. So on this part here, sa lower third, we have the mandibular, so a mandibular branch there. Okay, so we have to be very careful whenever we do procedure on the lower third of the face. So when it comes to thread lifting on the lower third of the face, what is our entry point? Okay, if you want to pull your marionette line, if you want to correct this, like for example, your patient already has this deep marionette fold here, you wanted to pull it towards your tragus of the ear. So your entry point will be this anterior to the tragus of the ear, like 1 cm anterior to that can be your entry point, and you can make your lines like a fanning technique again here. So you'll have 1, 2, 3 divisions there again, and then fanning technique also. Now there are cases whereby they wanted to correct their jowls here, the saggy jowls here, or also like those with saggy part here on the posterior mandibular region. You can have your entry point here superiorly to at the temple area, and make your vector like a diagonal vector like that towards your jowl. So you can do like also 3 threads there, or even more than 3, even up to 5. Or you can also correct your marionette there too. 1, 2, 3, 4, 5. Those are 2 approaches for lifting the lower third of the face. Okay, so we can do combination for Ms Vira, because I'm seeing a beginning jowling here, and there's a loss firmness, or there's already sagginess at this part. So our approach will be 2 entry points, so 1 superior and 1 inferior. Okay, so with our procedures, when we're doing minimally invasive treatments, we have to clean the area, disinfect, and we did already the numbing with our lidocaine cream. We had our EMLA cream a while ago. Okay, so when we're doing a marionette lift, our entry point will be anterior to the tragus, like a 1 cm anterior to that, or 1 to 2 cm, and then we'll just inject lidocaine across the track of our thread. Okay, so Ms Vira is so comfortable. She has a high tolerance for pain, or no?
Because your hands, your fingers are so light. They're like feather light.
Wow, thank you. And then another, or actually you can do the linear technique. Okay, just do that. Ms Vira, you look like Latin American, or like Spanish. You look like a mix of Spanish, or even like in Europe, what do you call them? From Brazil. Yeah, she's so pretty. Actually, I'm good with my lidocaine. Okay, so for our entry point, we'll make a puncture again. So cover, please. So as much as possible, we wanted to avoid any bruising there, and Ms Vira is not taking any blood thinner, right, Ms Vira?
Oh, I'm taking vitamin E.
Okay, so
Really the effect.
it's okay. This part here, and then that's my entry point. So I'm using this time spiral cog thread, and it has a 100mm length. So our entry point, okay, initially perpendicular and towards the marionette line. Okay, there you go. So it's like a superficial smash. Okay, and then pull out, and another one. So spread the skin, and second, so have to really position it in the right anatomical plane. Don't go too deep, because if you're too deep, you cannot see result. And a third one, and don't go too superficial, because the threads may cause some rippling effect on the skin, or denting or dippling. There you go. So there is our third thread towards the mandible already, and we do a cut. So pull a little bit and then press and cut. There you go. So we're doing the left side of the face and we are numbing the tract for the thread. So that's where the thread will go through. So this is lidocaine epi and we're just injecting like subdermally where your threads will be. And good thing Vira has like very good skin. And I should say there's really no volume loss yet, no tissue atrophy yet. She has a healthy lifestyle. And there you go. So the cog thread lifting for the lower third of the face, the entry point that we're using is anterior to the tragus. So this is like a vector towards the anterior part of the preauricular region, or it's like a horizontal vector. If our patient would want to do more of a V contour, we can do a different vector for that. So we can also do a V-shaped or reshaping of the face with these kinds of thread lifting. So our PDO threads are really very good in giving skin rejuvenation, and it's a non-surgical approach. It's a blind procedure, okay. But I could say that this is safer and it gives a more natural result. Plus, in doing thread lifting, we also assess for the symmetry of the face. So usually after doing this procedure, we check on our patient's profile view and check if there is, or rather a frontal view, and check if there's a balance on our procedure. So again, this is like a technique. Cog thread lifting is targeting actually more of the mass tissue to lift it, to pull it back upward, restore its original position. Because as we age, those soft tissues, they tend to go down. So this is the so-called the descent of the aging due to the pull of gravity. So you wanted to restore it upward, bring it back to its original position. And the good thing is we have our spiral cog thread to help in achieving that result. So we're targeting the marionette fold. So for Ms Vira, we wanted to prevent the aging. So this one is actually having an effect. As time passes by, you will still visualize or enjoy the improvements on the skin layer as well as the layers below or beneath the skin. So we have our third spiral cog, and that's it. And we're just gonna cut the remaining threads, cut it out. And usually we tell them follow up after 2 weeks, where we check on the balance or the symmetry of the face. So there you go, it's the cutting. And we're done with our lower cog thread lifting. So we'll show the result to Ms Vira when CSA Medical Aesthetics return. Back, so we'll show the result to Vira. Okay, Vira, here is our mirror, and look at the lower part of the face, how improved and lifted it is. Look at that. So this area we did here, we were targeting the marionette line here and a portion of our jowl, and I think there's an improved jawline here too with this 3 cog lifting procedure. Right, Ms Vira? Kamusta po?
Mabuti naman. I feel great.
Wow.
I walked in here. I thought I was carrying some luggage down here.
Yeah.
And then I'm emerging from your clinic. Like,
wow.
The heaviness is lifted.
Lifted, yeah. Because the goal of doing the lower third lifting is really to restore, or rather, it's like resuming or bringing it back to its original position. Because like as we age, diba, from the top going down. So as much as possible, the one that went to the lower part of the face, we wanted to bring it back to that mid-face section. And I noticed that there's this instant lifting benefit. So, and restoring like the jawline, the well-defined jawline that you had before. And actually, yung marionette, di na siya visible, right?
Yeah, it's like magic.
Yeah. See, non-surgical technique, I could see an instant result, natural looking, and later on you could still do whatever your activities will be, right?
So there's no downtime?
Well, yeah, no downtime for you. Although the others, there's some like, downtime for them, some bruising. But for you, we don't really see bruises. So later you can still have your meetings, right?
Right.
Yeah. Any message to our televiewers regarding this procedure?
Hi, I'm a satisfied patient, and I hope you will try this procedure as well, because 16 or 60, like me, we have to take care of ourselves.
Correct, yeah, correct.
Yeah, and this is not about vanity.
True,
This is about taking care of the only body that we have and feeling confident.
Correct.
Come and
Loving
visit
yourself.
CSA
Thank you,
and
Vira.
see Dr. Contessa Alapag.
Wow. Actually, I'm looking at your profile view, the frontal view. She's fresh looking. Di ka mga 60s, Ma'am Vira. You look a lot younger right now. We could say 10 years younger or even 20 years younger. Oh, ayan mga ka-CSA, we have done another non-surgical procedure for Ma'am Vira. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com. Our clinic is located here at the Infinity Shop, Pulong Maragol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. By the way, Ma'am Vira, do you have any like social media account that if ever they have a question, because some people would want to ask our guests too about their experience, about the result, were there any further improvements? Can they also reach you, like any Instagram or Facebook account?
Oh yeah, just look me up, Vira Arceo.
There you go. So my Facebook account too, Contessa Salvador. Okay, so thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.